And that's the home run, baby. Nice.
Can I curse on video?
You can say and do whatever you want.
Oh!
That's the home run. Beautiful.
Ooh.
Welcome to the office.
Thank you.
How can I help you? What brings you here?
In 1998, as I was driving on a freeway to actually a graduate school interview, supposedly a dry cleaning van went in reverse and hit my car at a high speed. Again, I have no memory of it. I was airlifted. I do know that I broke severely, had injuries, skull fractured, sternum, right wrist, left hip, left femur, left kneecap, right ankle, and about a year of inpatient for the hospital for a little over a month, and then about a year of outpatient physical therapy, occupational therapy.
So you sustained several injuries.
Mm-hmm.
You went through rehab,
Mm-hmm.
right?
And then I had multiple post-op surgeries then on my knee and on my hip and femur rod.
Tell me about the femur. Yeah, what happened with the femur?
Broken, and then the femur rod fixed it, but the knee...
You mean they had the long rod in there?
Yeah, you
Is that
can
what
see the...
I got it.
Okay. And something, though, was wrong, and again, it's a little bit hazy, probably because I was still also recovering from the TBI, but when they reattached, then they did have to re-break something lower down to realign it.
They probably had to mess with the tibial plateau in order to align it.
Okay.
I'm assuming that's what happened.
And growing up, I was a competitive gymnast.
Oh, nice.
Yeah. When this leg is reattached, it's pointing forward, but I was, even for a gymnast, abnormally flexible. And so this leg, naturally, I had a very strong turnout. So it's kind of like that when I lay down.
Okay.
And definitely, I notice a pull.
We'll look at the gait. We'll look at all that.
Okay.
All right, so we have some of those structural issues. We have low back issues.
Yes, low back issues, but it also shoots up, and I have pain up through here and even under the skull,
Okay.
on both sides, but it's definitely worse on the right side.
What's number one for you right now?
My lower back pain.
Number one.
Mhm.
And you're saying it shoots up, it doesn't go down into the legs?
Occasionally I do get shooting pain down my legs. I have a lot of neuropathy. I believe that's related to my leftover porphyria symptoms, though. Sometimes I do.
What? Now we have a second issue we have to talk about.
Sorry,
Because this is actually
switching.
something new, but I'd like to, can you share that?
Sure.
What you're saying?
I have a very rare genetic disease called acute intermittent porphyria,
Okay.
which is a
Porph, so like porphyrin ring, something to do with blood.
the red. So technically, the stuff that makes your blood red are the porphyrins, and my
Porphyrin
body
rings, yes.
doesn't make that.
Well, it's the heme.
Right.
Right.
So I have the hepatic precursors in my liver. Normally they combine and make heme. Number one, that gets oxygen to your blood. You get energy.
Correct.
So I lose the energy, but
So
worse,
you're not actually making the heme. Is that what you're saying?
Then my body says, hey, we have no heme. So they output the precursors in an overload.
Okay.
And those precursors alone are poisonous to the nervous system. And the effect is similar to lead poisoning.
Or an iron overload almost.
No,
lead
perhaps,
poisoning.
but
lead poisoning.
Yes. So it starts with very foggy brain, but it can go to the point of psychosis, and it also attacks to. It starts usually, I can feel tingling in my fingers. It's maybe hard to type, but then it can progress to complete paralysis and seizures.
Okay.
And of course, just exhaustion also.
And you were diagnosed when with that?
2012.
2012.
Interestingly, even though you can have the gene, most people who even have the gene, which is rare, it remains latent. It's almost like you're somehow in a protective bubble.
So what makes it?
They
what
don't
express?
know what makes it become unlatent or what
There's
pierces
something
the
in the
bubble.
environment that activated that gene.
Or it actually is, the gene is equally common in women and men, but it's more common to be activated in women because one of the important things that does activate it is a combination of female hormones,
Oh, okay.
but not alone. So it's definitely unknown. One of the definitive triggers can be certain medications. So there is a safe medication list. It's very specific. I have to be very, very careful.
Okay.
If I take some of the wrong antibiotics, for example, it would send me right into immediate attack and be hospitalized. So after 2012, for a period of time, I was definitely hospitalized more than not and pretty much non-functional. But luckily, I was one of the first 8 people in the United States to receive a new RNA therapy. I was in the clinical trial. They had to work with all of the different dosage. I was kind of the guinea pig, but it works. And so now here I am, and I'm healthy. And now not just healthy, we're working on getting me hopefully less pain.
Very cool.
It's wonderful.
Okay, so you're in remission, or
I have a
it's-
monthly shot to get the RNA to quiet the genetic deficiency, and
Okay.
it usually keeps it in remission. Sometimes I get mild attacks or mild symptoms, but
Okay.
mostly not hospitalized since then. I do sometimes have shooting pains from neuropathy to the point that sometimes my limbs will, sometimes
Like a
once in a while
spastic
it'll sit
paralysis
up or my legs will flip up.
I better not stand there. Stay right here.
Usually
I'm gonna sit to the
mostly-
side.
Watch
Okay. Okay. So why are you here? What do you? What can I?
Well,
How can I
I really
help
hope that mostly is that residual, especially lower back pain and up. And on the right side, it really feels very lopsided and twisted.
you? Okay.
It's uncomfortable for me to sit for any length of time. It's uncomfortable for me to stand. And just any relief to improve my general quality of life would
Okay.
definitely help.
Okay. Very cool.
Yeah.
All right. So we need to figure out kind of what's going on first,
Okay.
and what can I do for you?
Okay.
Okay.
Yeah.
And what is it that I do?
Work on the spine.
Yeah. So we need to evaluate the spine, the extremities. I'll check everything for you.
Okay.
We'll go over your X-rays. We want to kind of see what's going on.
Mm-hmm.
We'll watch the gait, watch the walk,
Okay.
and then we'll examine and figure out where we're going to start.
Sounds great.
Okay?
Uh-huh.
And any questions along the way, you ask.
Okay.
You're uncomfortable with anything, you stop me.
Okay.
Okay?
Mhm.
You've watched any of my vids?
I've watched a lot of
Okay,
my
so you
husband's
know-
obsessed.
Okay, but you see what I do, right? So there's no surprises here.
No. And actually, I also have been having, I had
Your
a lot
right
of
eye
sinus.
seems a little different than your left.
I've had a lot of sinus issues on this side. In December, I had tonsils removed for right side.
Look at her eyes. Look straight ahead, please. I just want you to see. Look straight ahead. Back a little bit. Okay. Close your eyes for a second. Okay. And just open them. That's it. And you can see the right eye is slightly smaller, like the lids are slightly smaller closed, maybe from the sinuses. Whatever it is, we'll take a look at it. Okay. Open. Great. Like she's it. Now open wide. Open your eyes wide. Now you can see the difference. Okay. All right, no problem. So this is a picture in time. It tells me how you've evolved from birth. 24 bones in the spine, 23 discs in between. This is looking at you from behind. This is looking at you from the side. I want to go over this X-ray first, okay?
Mhm.
So let's do this one first, and let's talk about what we kind of see here. And as I said, we have 24 bones in the spine, 23 discs in between. I want you to think of this as a 24-story building.
Okay.
This is the foundation of your building.
Mm-hmm.
In order to have a stable building, we need to have a level base and foundation. And so the first thing is, let's look at the base and the foundation. And what do we see? Okay. So we're looking for balance and symmetry. Are we symmetrical is the first question. Now, here's what I see, and I want you to see what I see. You have a bend in your sacrum, man. It's right there. Does this and then this. There's a bend in the sacrum. The pelvis, that's the pubic bone, that's the crease in the bum. So we have a little bit of imbalance going on there, but you had an old tailbone injury in your tailbone. That's
Okay.
the first thing I see. Does this side look higher or lower than this side? Look at the right, look at the left.
Higher.
You see this hole here? The
Uh-huh.
obturator, is it bigger, equal? One is bigger, one is smaller, right?
Uh-huh.
These are just x-ray projections.
Okay.
So it's just telling us it's not symmetrical. That's all that's telling us. Let's look at the SI joints. We can see through both of them. We have a little bit of scar tissue in here compared to the right. But we're going through it. It's a little swollen on this side if we compare it to this right side. Do you see that?
Yeah.
Okay, so let's go a little bit closer. And here's what I want you to see first in terms of the sacrum. Let's look at the numbers. There you go. That should make a little more sense. Okay. PI4IN1 on the left, P1-L, and a little bit 2 millimeters down on the right. Measured difference of 5, actual difference of 6. What does all this mean now? The way the pelvis works, you've heard me talk about it. One goes up, the other goes down. One goes in, the other goes out. We have a slight imbalance on the left SI joint. So P4IN1, what does that mean? That means the left side goes down 4 and in 1. That 1 is very subtle. It's very slight. And then the sacrum on that side goes 1. Again, 1 is very subtle, very slight. But it is showing us there's an issue on the left SI. Now, here's the twist. The PI is down on that side. Measured difference is 5. Actual difference is actually 1 point higher. So what does that tell us? There's a lot of good information there. If I fix your left pelvis and I bring that side up, the right side goes down a tiny bit more. So the answer is not there.
Mm-hmm.
The answer is in the bent tailbone. Because we have, if we want to classify it, they call it, I'm mindful of using this term, sacral malformation. It's all it means is you had an old tailbone injury, it formed differently.
Mm-hmm.
Okay? And so on the right side it's down 2. If we negated that 2, the measured difference would be 3.
Mm-hmm.
But still correcting it would make it 4. The good news, it's under 7 millimeters total regardless. Under 7, according to the Gonstead work, adjustments will hold. That's the key. So I'm just giving you, I just wanted to give you that. But the key I'm saying there is the answer is going to be somewhere down here.
Way low.
It's in the low. It's in some old gymnastics injury we're going to figure out.
Okay.
We have a sacrum issue. Yes? We have a left pelvis issue, but if we have to decide between the two, let's come down a little bit. I want you to see this. So your sacrum goes this way, kind of lists to the left slightly, doesn't it? But then where does your spine go?
Yeah, just the right.
That's the disconnect. So now let's go to the big film. Let's look at the overall presentation now. And let's see.
I'm shocked at that curve.
Well, this is gymnastics, young lady. This is definitely gymnastics, part of it. Now you can see sacrum goes that way, and then where's the spine going?
The opposite.
Other way. And then right about here, what is it trying to do? Compensate that, otherwise you'd be way over here. Then from here, it compensates to here. So 5, 4, 3, 2, 1, 12, 11, 10. And then what is it doing up top here? Curving back again.
Mm-hmm.
I don't really like this part here, and I'll tell you why. Because that's the heart side. So when you're getting compressed, I know it's affecting the chest.
Okay.
Okay? And that's the part I don't like. But you can see there's a lot of compensations going on.
Mm-hmm.
It goes one way, then the other way. Now let's go up a little bit higher and let's see what's going on here. Same thing. You see it, right?
Yeah.
So right about here is what's causing all your neck issues. Your neck isn't coming from your neck.
Okay.
So you can see it from here. It goes like this.
Mm-hmm.
This is a side slip. T1, T2, T3, T4 is a side slip. You had a nice fall there, separate. This one. So it's actually gone to the side. T4 side slip. This is going to be one of the fixes. If we don't do that, your neck is never coming back. Because typically when those vertebrae misalign, they go back. They go back, then they can wedge up on one side, then they twist. When we see a lateral shift, that was a trauma. It's a very different adjustment. I call it spicy. It's a little spicy. Okay? But I think you can handle it.
All right.
All right. Let's continue. Okay. Upper cervical up here is good. We do have a deviated septum. The heck you do in your nose, yo? We'll deal with that. If you want me to.
Yes, please.
Okay. And then we have a right jaw deviation, left compensation. So when you open, it deviates from right to left. And then you can see the ramus of the mandible here. This is thinner. This is thicker. That tells me this is compensation. This is the main issue. Okay?
Yeah.
And this is secondary to whatever's going on in the upper cervical. So we have a TMJ. We have a nasal septum. We have a lot of curvature stuff going on in the spine. All of this is secondary. We have a T4. And that's all secondary to the foundation down low. The digestion I did mention, right? We're going to need to, this is all that gas. This is undigested food in through here. This is the ascending colon, transverse descending. This, you said you had a lot of OTCs, right? Over the counters? Ibuprofen?
Yeah.
Now, neurological control of the stomach is in this area, by the way.
Oh, wow.
Yeah, T5, 6, 7 area.
Let's get it.
That's well, it's whatever I find. I'm just
Okay.
showing you stuff.
Wow.
All right, so those are all the fun things. And why digestion? You see that little air bubble right there? That's called a Blvd. This thing should be, this black circle is not this. This is your poop. And your sorry, this is your poo-poo coming. And that's the gas that's with it. This is your stomach. This is your colon.
Okay.
This is the gastric air bubble. It should be this big on the x-ray. Should be like that. Now, when I don't see that and I see all of this stuff, I know there's digestion stuff. And I'll talk about an easy solution to get it going. And what we do is, besides what we find in the body, we're gonna introduce some betaine hydrochloride. And it's an acidifier. It's to help acidify the foods and help your body activate the enzymes of digestion and get everything started all over.
Okay.
Okay?
Great.
It's not about doing colonics and all this stuff down here.
One of the problems of having repeated porphyria attacks during attack, when the neurological system goes down, it also goes down to the point that you can't pee or poop because those systems aren't activated. So I would have to usually be catheterized and just,
so what you're
it didn't help
describing
that
is the parasympathetic nervous system. Parasympathetic is what you're telling me.
I think I guess both were totally
Now,
affected.
And is there more of a paralysis? Like you can't move?
Yes, usually my left side would become paralyzed. I never had my right side completely paralyzed, but some people happened, and I was fortunate enough to have doctors catch it before I would be.
Got it.
But I mean, with your left side completely paralyzed, you still can't walk or do anything.
Correct. Now, this is your neck, ma'am. We're going to go more into the lateral film in a second. Actually, why don't we do that next? So, that's your A to P. You understand what I went over here? And this is your foundation, the numbers. You understand what I did there? And explain. Now let's talk about your posture and explain some other things. This is the side profile in a posture assessment. They do what's called a plumb line. We're doing L5 and we're running a line straight up. It should bisect C2 and C7. Your upper body is slightly behind the foundation, so these muscles up top are working a little bit harder to keep you out on balance, on point. That's part of the tension you have up there.
Okay.
So part of that neck tension, again, is coming from getting this foundation right and getting this forward. Okay? With me, the homework is very simple. It's water, walking, and ice.
Okay.
It's simple. It's not, there's no crazy rehab protocols, things like that, okay?
Yay.
Seriously, it's just walk. And now, wow, you have a great L5 disc, lady. Oh. Oh. Cool. Wow, I didn't expect that. Good. Good stuff. All right. Your disc is great there, L5. That's almost textbook.
Yay.
L4, L3, L2. This area is from the curvature. So we're looking at the undersurfaces of the bone there. Okay?
Mm-hmm.
Your disc is fine, but because it's tilted on the other film, we're looking underneath the bottom of the bone, so it looks bad, but it's
Okay.
not. Okay? Same thing there. There. But here's what I need you to see. Right here juts the whole spine back.
Yeah.
This one here.
Which one is that?
5, 4, 3, number 2. But 2 is, these are all compensations to whatever's going down here.
Mm-hmm.
This is the sacrum. It should be a smooth arc. You see that nub right there?
Yeah.
That's an old tailbone injury. That was your gymnastics.
Okay.
I'm assuming. I'm going to assume.
That makes sense. I definitely started when I was little.
You see what I'm talking about now?
Yeah.
Yep.
Oh, wow.
So this is what kind of started the things going off balance. Now, 5, 4, 3, 2, 1, 12, 11. Some old compression injuries, okay? You can see it's kind of, bone looks smaller. There's an old compression injury. But good news, your discs are great.
Okay.
Okay? That's your good news.
Good.
So we got lots to work with here. Oh, the fun one now. Okay. So, discs are good. You can see old whiplash injury. That's probably the car accident. But the disc maintained, even though the end plate got a little thing. You can see C6 right here.
Mm-hmm.
2, 3, 4, 5. Tilts back a little bit, right?
Mm-hmm.
It tilts a little bit back. Now, I want to zoom in on do more of the flexion extension of the neck and get some answers here. So, we do have some instability in the neck. We should have a smooth forward curve. I said your discs are great in terms of they're good. This one is a little less. This is C3. C3 is tilting. These are all kind of tilting, but the answer will be when we go into flexion. When we go into extension, it looks really good, doesn't it? They all line up. This one is pinching. When you go up too far, that cuts a little bit of C3 off. 3, 4, 5 is part of the diaphragm. 3 has connections to the eye.
Oh, wow.
I'm just saying, sorry.
No, it's interesting.
Now, here's what I need you to see. You see the difference when you go forward? Completely different.
Yeah.
Look. Looks perfect almost, right?
Yeah.
Textbook. Then what happened? This is all instability.
wow.
So this one didn't move, did it?
No.
That one move or no?
No.
No?
No.
And then that's all hypermobile.
Yeah.
So we ain't touching up there.
Okay.
It's starting down here. 7. 7 comes from 4. T4, remember I was showing
Yeah.
you? Yeah. I'm just showing you the pattern now.
How are 7 and 4 related?
Well, 7 is off, but
Oh, okay.
4 is off
Okay.
too.
So
I'm not,
7
if
is
I
off
if I
because
do
of
7, but I don't figure out any of this, nothing holds. The whole point of the side slip is nothing's going to get fixed unless we fix
Okay.
that. So I'm showing you 7. I'm showing you 4
So
potentials
7 is slipped or 7 is wrong. because
7 is
4
off.
slipped. Yeah.
because of 4. But now 4 can be from any of this stuff because all of this whole thing is compensating from down low. So the main issue with you is going to be figuring out where the heck down here we're going to start
Okay.
and get you walking as much 10, 12, 15,000 steps a day.
Okay.
You have access to a pool? Is it plunge open?
No. Not usually I swim, but right now.
Okay. Well, when it's time,
Okay.
okay, that's going to be one of your staple
Okay.
exercises.
Great.
Go to, okay?
Mhm.
All right. Are we clear on that?
Yes.
You understand? Shall we start?
Let's start.
Let's rock. So just looking at her sit, there's a lot of wasted energy here. Okay, you can see this muscle is pronounced. This is down. The crease is higher here than here. Now you can see the kink in the spine as we were seeing on the film, okay? Bring your right hand behind your back, ma'am, for a sec. You okay doing that?
Mhm.
Okay. Right hand forward. Bring your left hand behind your back. Okay. Bring it forward. Okay. Let's go ahead and start with the scoping. Starting at the base of the neck. 8, 9 points, C7. I'm getting heat up top, but I'm not getting a break. So we ain't messing with that one. Yeah. 7. Oh, we got the spicy chimichurri right there, T4. Man. 10 points, T4.
Ding, ding, ding. It's a winner.
Now, it looked like it was going to break there, but it didn't, so this is compensation, ma'am, okay? And there it is. S3. S2, 3, or a little lower. There it is, S3. Okay, so we're getting S3, we're getting around that T4, and I'm getting the C7 today, ma'am.
Okay.
Can you scoot forward, please? Let's check the movement in the hip. Feet together. Feet together, open and close the knees, please. Feet touching, open and close the knees. Open wide and close. Open and close, open and close. Right side only. So there's the right, there's more of a shift of the tissue of the tailbone sacrum, not the SI joint. Do the left side only. A little more fixation right there. You feel that?
Yeah.
Okay. So this is the right SI joint. This is the top of the joint. This is the bottom of the joint. I'm feeling it right there. Now, more tender at the top, more tender at the bottom.
It's more tender when you touch at the bottom,
Okay. But
when I'm sitting, I actually feel more pain inside at the top.
got it. Okay. But it is the right side. You
Yeah,
feel it more.
yeah.
So it's a little misleading on the film too. Scoop back for me, please. All right. Let's feel down low. L4. You okay with that?
Yeah.
Good. L5. Little tender. S1. S2. Tender right there.
Yeah.
S2. Dude, you're a trooper, yo. You have a high pain threshold. I know this hurts, but you're holding it good. Right there. More tender here
Yes.
or here?
Bottom.
S3, man. S3. All right. Static palpation. Ah, there it is. Swelling, edema, point tenderness. More tender there or there. Bottom or top.
I think the bottom, they both hurt.
They both hurt, right?
Yeah.
So if we have two joints that hurt and we have two bad ones, we're going to do one bad over another bad? No, we're going to do the bottom one. 7. 1, 2, 3. Right there. T4. Yes?
Yep.
Okay. 7. Seven is off a little bit more there. That's 1. 7. But it's still moving.
When you're pressing 7, it's literally making my ear roar.
Okay. Well, we'll deal with it. So we have C7, we have T4, and we have sacrum. S3. That's where we're going to start.
Okay.
You ready for me? Let's do it. I'm going to do T4. Now, T4 we said is a side slip, remember? 2, 3. I got to do this in 2 parts. I need to come around that side. And 2, 3, 4. So part 1 is being on the right side of the side slip and opposite spin. Home run. Part 2. Hi. You okay?
Mm-hmm.
Set it deep. That's the rest. Good. Right, we did T4. Now we need to come down to the sacrum.
I'm a little
We're
scared
going
of
to
this
do
one.
S3. 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 You good now, man?
Mm-hmm.
The key with this is just focus on your breath, please. Palms up and receive. Good. Good. Deep breathing. Good. There it is. Gotcha. That's the home. You okay? You survived the worst. Hold my hand, please. Come up slowly.
Okay.
Hold both hands. March in place, please. Just making sure.
Yeah.
Dizzy?
No.
Okay.
I'm okay. Yeah.
Can we walk, please?
Uh-huh. It actually feels stronger already.
Nice.
Wow. Like way stronger.
And
Wow.
this ain't paid advertising.
It's true. Oh my goodness. It's already so different.
Uh-huh. Cool.
I'm like a little nervous, but
For what?
oh, I don't know.
Sit on the floor, please, against sit on the floor against the door, please.
Sure.
I just want you to see this before we continue. Stand up quickly. Check it out.
Wow. It's a lot better.
Good.
It's such a deep release.
This-
Wow.
Very nice.
Woohoo!
Very nice.
Yes, thank you.
You're
Oh my
welcome.
goodness.
Have a seat.
Wow.
Well, you asked for relief, right?
It's so much better. I'm in shock.
Okay, let's go back to C7. Chin up, ma'am, so I can close that a bit. Good. You good there?
Mm-hmm.
C7. Now, get up. Good. And that's the home run, baby. Nice.
Can I curse on video?
You can say and do whatever you want.
Oh!
That's the home run. Beautiful.
Ooh.
So walk straight line now this way. There you go. As you're walking, tell us what's different.
The whole being able to walk feels a lot smoother.
Okay.
My body, my back feels, I don't know how to describe it. It feels stronger. Like especially my lower back feels stronger. It just feels a lot smoother to be able to walk. Especially, I mean, I notice myself, usually when I walk, it feels jerky and
A little smoother.
requiring more effort.
Very cool.
Yeah,
Awesome.
super cool. Thank you.
You're welcome. What else she's saying? Is this okay for you?
Yeah,
Awesome. Shall I continue?
please.
C7 is clear. T4 is clear. You're all clear, lady. Check it out now.
Wow.
L5, all the way back. Mira.
Yep, and no clicking.
That's one. Mira.
Wow.
All the way back. Come on, I got you. Oh, okay. Mira, you're a gymnast. I forgot. Sorry. Oh, shit.
You really want me to go all the way back? I will.
Check it out. S3.
None of them are moving. Nothing's clicking.
Well, no, they're moving, but they're
But
they're
it
in
does-
balance. Don't say none of them are moving. They're all moving, lady. Now,
I'm just used to feeling like
clicky and-
clicks and kind of like hard to get back up.
now, can I continue?
Please.
Shoulders. Let me do the work. Let me do it. Shoulders. Ears.
Ooh.
Raise your right leg and down. Relax there. Raise your left leg. Relax. Yes, Talis. Stand up for me, ma'am. Let's do the hands now. Check the hands. Squeeze. 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 Elbow. Let me do the work. Squeeze. Squeeze. Relax. want your nose job today or next visit?
Today.
Okay, chin down. So you can see the deviation. So if I go from this side, the bone is there, that's fine. It's there. It's right there. Correct?
Mm-hmm.
Okay, breathe through your mouth. I'm on your nose. We're on the septum. We're bringing the nose all the way over. Gotcha. Yeah. Deep breath in through the nose and out. One more. There you go. Hi.
Hi.
It's different.
Yeah. It's good. It's a lot better. I can feel release over here. Less pressure.
On the eye.
Mm-hmm.
From a nose job. But it's all voodoo, they say. Let's walk. Let's walk.
Wow.
What you think, lady?
I feel 100 times more stable and just smoother.
Okay.
I still have some residual pain in the nose,
Yeah.
but it's good. But like I said, I feel a big release under here.
You're gonna be okay.
Thanks.
Questions for me?
I can't wait to see you again next time. What more magic?
Okay. Welcome to the office.
Thank you. Thank you for everything.
You're welcome, Paul. Thank you for sending wife. And she says you're next.
Thank you, Paul.
You got it.
I'll see you next time.